Hi, my name is Dr. Imankusumadirja. I'm from Indonesia. I want to Good evening, everyone. Welcome back to my show, Dentistry Talk with Imankusumadirja. And today or tonight, I will have a very special guest, a friend of mine from Australia, is it from Melbourne? From Canberra. Canberra, yeah. Okay, I would like to introduce our guest star for tonight, Dr. Linhlan Nguyen. Is it right? Is it the right spelling? Yes. And Dr. Linhlan Nguyen, Bachelor from Dental Surgery from Sydney University, also fellow from the International Congress of Oral Implantologists, and also a Master of Science in Laser Dentistry from Universidad Católica del Sacro Cuore. My fellow student, graduate.
Yes.
Hi, good evening, Lynn. How are you?
I'm very well, thanks. Good evening, Iman. It's good to see you.
It's about 10 p.m. right in Australia?
Yes, that's correct. And it's Monday, so tough time.
Yeah.
How was your day and how's everyone's day?
How was my day? My day is like usual day.
Mm-hmm.
Do some practice with some patients. It's almost like a regular thing. And how are you? How is everything in Australia?
We're good. Canberra, as you know, is in between Sydney and Melbourne got COVID going again.
Okay.
And Sydney start to have some cases going again, so we're kind of in between, and we keep our finger crossed, everything crossed. We won't get the same problem, and so it will be so disruptive. So we just try to do the best we could and just try to stay away from trouble.
Talking about COVID, okay, so I think the problem is all over the world, but what kind of PPE do you use?
For us at the moment, Dental Board will request we practice at, in general, except for Melbourne or Victoria, we all practice at level 1. That means that we almost could do everything, but we have to wear face shield, all the disposable gown, patient, we're going to still have to ask questions about where they've been, taking temperature, we'll do keep record of who's delivering our goods. So basically for, tracing, if there's any events that breaks out. Dentistry, patient have to have a pre-oral rinse before we start procedure, rubber dams on, and preferably with things that, too much aerosol, blood, and we should have high speed evacuation. If on top of that would be those, like Zimmers and things like that. TBH, extra high speed.
Well, in Indonesia, it's maybe you heard it from the news. It's about like over 90,000 cases now. Yeah. I think Indonesia is one of the worst, maybe. And now we are using the level 3 PPE.
Right.
So, the N95, so surgical coverall, surgical gown for the patient, and it's it's getting higher and higher.
Yeah, I understand. It's very hard to practice, especially when you do so like yourself, doing a lot of surgical procedure.
Yeah.
Wearing, that kind we call moon suit.
Moon suit.
Yeah, it's very.
We're like astronauts nowadays.
Yeah, it can be, it's just not good.
Yeah. Okay, so maybe we can go to our topics for today is about laser dentistry and facial aesthetic.
Yes.
I'm going to bring some controversy in this conversation tonight.
For sure.
So, how about I want to know a lot of things related to the Australian regulation for about for the first thing is laser dentistry.
Mm-hmm.
Is it any specific regulation in Australia related to laser dentistry?
No, not at all. Laser dentistry, we call it, but it's laser to us. It's just like another tool to help us doing better dentistry. The more you learn about it, the more application in all kinds of fields. So any kind of specialties that claim this is their so-called tools or toys or whatever you call it, I think it is, it's not right. It's incorrect to think that's the case. Yes, if you own a laser, potentially, yes, it can cause a lot of damage. Luckily, orally, the tissue is very giving, as you know. But yes, you can cause damage to the eyes, or ceramic if you don't know what's going on and not understand the laser physics. Yes, you probably can't perform what you would love to. And I think for a long time, laser have that bad reputations for, There's not enough education, so people just don't know. You can never throw out a set of settings, and then you won't get the same result as someone next to you. So there's a lot to it. But I don't see it, and I agree, Professor Oliver, it's not laser dentistry, it's lasers in dentistry. And so, that would be there to help us doing a better job. And there's still additional dentistry, there'll be things that laser can't do, so it's not everything. And sometimes people feel a little bit offended, left out.
Yeah.
When we want to talk about lasers,
But some countries, maybe it's not the regulation yet, but they thought that laser belongs to some particular specialistic department in dentistry, but well, if you ask me, I will not answer that question. Maybe you can answer the question. Do you agree with that?
No, I don't think it belongs to certain specialists, because like I said, with you using the BioLase, I use the Lightwalker, and so they've got so many applications. So just to say, because I'm a surgeon, so therefore we do surgery and laser's good for it, so it belongs to the surgeon, other people can't touch. I totally disagree with that. So no, it should not be. Should be available for everyone.
Yeah, because I agree with you, but with some dentists maybe feel threatened about it, and I think maybe laser will require you to invest more. I mean, not just buying the laser, but also with the education, because you can cause a lot of problem if you don't know about the specific wavelength, have a specific chromophores, target chromophores. So it might cause the danger. I agree, totally agree with that. But sometimes when you can have it, you cannot have it, then you might as well say it's difficult, it's dangerous, something like that. What do you say about that?
I think it's also true that yes, just any profession, there will be a small number of people who are reluctant for change. And so there are so many excuses and so many reasons, and because they don't feel comfortable stepping out of their comfort zone. And so therefore, using all sorts of, excuses to find it now that it's not safe. So I think for that, we need to educate more little talk. My hope would be one day in Australia, we would be, with younger and younger academics involved, we'll be able to teach laser as, part of dentistry and many other things.
But the problem is, how can you start to teach someone about laser when laser is restricted to some part of the departments or some part of a field in dentistry, right?
Yeah, so I would say to start with small talk, it's different levels, keep having small presentations. there's no regulation to stop anyone to present any lecture. You cannot perform procedure if so deemed, called, you're not allowed to, out of scope. But pretty much any lecturer anywhere can sort of, talk about it. And the more you talk about it, the more you would basically would start to make a curiosity to start with. And that was my curiosity to start with laser dentistry, just to say what it's all about.
I couldn't agree more.
Yeah.
I would like to welcome Dr. John Cutter from the Philippines. Do I have John? Here you are. I would like to welcome Dr. John.
Thank you, Doctor. A pleasure to be here. Dr. Linhlan and I keep missing each other by inches as we travel around the globe, so this was an opportunity to first hear her talk, so that's a great treat.
Yeah. And then what about laser in the Philippines? Maybe if you can share a bit.
I grew up, I'm the old timer here probably. I grew up adopting lasers in the 1990s. I studied under Terry Myers when Terry and his brother retrofitted the ophthalmic and the egg and turned it into a dental appliance, and then worked with Joel White when we were trying to get FDA clearance in the United States. And since the 90s forward, I used laser-assisted dentistry in my practice, primarily as a soft tissue instrument. And then I had a chance to be on the same platform at a Philippine Dental Association meeting a couple of years back, and shared that with Dr. Jason Hong from down in Australia. And he was nice enough to invite me to a launch of Lacuna's LifeWalker, and I was just blown away. I came home and said, yeah, within that 15 more years, this is really exciting. It's really a game changer. And what they did with rotating the beam, as well as the increasing scope of photobiomodulation, it's just what we had hoped for 30 years ago. And like Dr. Linhlan said, we looked at it as another instrument. It's laser-assisted dentistry. Does it require its own specialty? Nah, maybe one day, but I think it's a more general than that. And it'll be up to new thought leaders like you all to basically carry that flag forward. But it's been an amazing journey. I still talk with Dr. Robert Pick. Back in the day, it was NdEgg or CO2 or argon, and Bob Pick was the guy who headed up CO2, and then Kim Kuch, who now does Canberra studies in Oregon, he was argon, and that's all we had. And my first laser was a $50,000 price tag, which was about $20,000 more than I spent on starting my whole practice. So it was a gut check, but the amount of revenue that it brought, and more importantly, it opened up all of perio to my family practice, which was always a slog. But after that, it just became a breeze, and we were believers. Yeah, we left the States in 2014, and my hope was that eventually hygienists would start to be able to use laser-assisted care as well for simple curettage and maybe some gingivoplasty on certain areas. But those days haven't quite gone forward in the States, and now we're here in COVID. But thank you. I appreciate that.
Yeah. Well, thank you for joining us. I hope you can stay here until the show is done.
Sure.
Okay, so back to Dr. Lynn. Lynn, so what do you do with laser in daily basis? What kind of work do you do?
Well, Kim, my dentist, assistant dentist, since she came on board. And so the rules there is anyone who came on board will have to go through the path of direction of my internal continuing education, and laser is one of them. And so Kim completed her LAHA program, And every time I turn around and need my laser, Dr. Kim used it, Dr. Lin, and every time, so between the two of us, so we end up with 2 light workers. And I keep saying to Paul here in Australia that it should be, every operatory should be having 1 light worker, whatever laser you prefer, hard tissue cut, whatever. But like today, I had a full-on, lots of surgical. We had extraction socket reservations, restorative work, which is interesting. We did surgery. And end of the day, we actually got a full-on 3D skin rejuvenation for a patient who we started with a lot of dentistry, and then her wish now was just to carry on aesthetic, and that's exactly what we do. We don't jump in and just start patients with, a random skin treatment as part of the whole treatment plan. But today is one of those days where I do a lot of things with my lasers. But a lot of, and probably the busiest part is my lasers doing photobiomodulation, because we're seeing a lot of patients with TMD, chronic pain, and because of surgery, they come for 3 applications, just basically pretty much healing induced pain. So it's going all the time in my practice too.
Okay, so so you do everything in most of everything in dentistry with laser, and related to the other topic, it's facial aesthetic. How do you start? How did you start with facial aesthetic?
Okay, I seem to start everything I start in dentistry seems like I jumped in a deep end, like coming in. Let's take a few steps back. About 10-12 years ago, I started my journey with CEREC, and I think I did post that somewhere on my Facebook that it was a game changer for me, because from there I got the opportunity to mingle with a lot of very progressive dentists. And so we started to talk, and part of CEREC, in order to bond ceramic well, you need to control moisture, and often we open up a deep amalgam margin and bond properly. So one of the educator at the time, he said you should start to look at least a diode. And so that's where I started with CEREC, and then I'm happy dropping gingival. That's about all I'm doing. I wasn't really into periods or anything with my diode. And then sort of a bit ignoring, very happy what I'm doing. In 2012, I started to go on the journey of doing facial injectables. And that was because I'm at the practice now almost 20 years. And so as a patient's doing well dentally, now that dental health get better, they start to think of, the veneers, crown, and next thing will be smile makeover. And so that's why I'm trailing along the track of facial injectable, facial aesthetic as part of it. And so that was back then, Australia started to have that wheel of motion happening. And that was through the Australasian Academy of Dento-Facial Aesthetics, where, they will push on for that. And so, but then my clientele in Canberra, in the practice I have, didn't quite actually accept, Botox fillers as well as I imagine they would be.
Yeah.
Everything's natural. So for my clientele, that wasn't really a way to go. And then 2015, I got Paul here, the rep for Fatona, actually at the first aesthetic conference in Australia for dentists. And then I saw the Lightwalker for the first time showcase. And all the interest were that I heard the word facial aesthetic. I can do facial aesthetic. Ding ding, the bells sort of like, and then also I can do night laser, anti-snow treatment. I'm treating patients with sleep, doing sleep medicine. So that's all I care. I want to get this machine, and I want to do facial aesthetic. I want to do night laser, and the laser dentistry probably doesn't work as it's. Yes, at first I would just take on that mentality now. It's very, very hard work, lots of learning. It probably doesn't work as well as what it's selling for. And a lot of laser back then, here in Australia, got a reputation for keep breaking down, a very expensive door stopper, they call. And so just basically going on to it. And then when we get home, you start to get curiosity. You get into Laha, got these journals. And then people got beautiful results. Why can't I get it out and do it? So we started to look up manuals and started to look for setting. And then whatever I pushed on would for a big pig head. And whatever setting we put, it just ain't dong dong, you know, like it just would not go. It tell me parameters out of reach, you know. You know, like gingivectomy or, you know, doing bone surgery, this is the setting, this is the pulse width, and they give you a whole range, anything from 50 microns to 600 microns, and you push anything, whatever they said, the laser wouldn't go. You know, I'm thinking, that can't be possibly right. And so the Jason Tang and Hisham started to have a few art courses here and there. I kind of appreciate a little bit more. And then to Laser and Health Academy start the program.
So Jason started the laser before you?
Yeah, Jason, I remember probably about 2009.
Wow.
As I started, 2009, I was only doing gingival troughing and that sort of thing.
And he already did photobiomodulation.
No, probably not so much back then.
Not so much, okay.
Yeah.
So speaking about before we talk about facial aesthetic, I'm so interested in discussing a little bit about your thesis. It's can you tell us please about your thesis?
Yeah, again, I'm coming on a journal of Rome, the journey of going all the way to Rome, because I'm very happy with what I've got with Laser and Health Academy. I've got I make a lot of uses out of that program, and I'm very happy. But then my interest is to aesthetics, and I want to learn more, and I want to have a formal so-called university base, and I happen to be at the right place at the right time, you know, all the time, from Laser and Health Academy, and then Professor Olivier for this program in Rome. So I came across that I want to do something, a bit of laser dentistry, but it's also related to aesthetic. And it's something that I'm very curious about. I've got a few cases that I started. It seemed to be interesting. And I decided, and also a bit of involvement with some of the charity group in Vietnam who we financially support, you know, a lot of people who could not afford medical care. A big group would be, cleft lip and palate patients. So I thought, okay, I'm going to go in and we'll do scar revision for patients with cleft lip and palate. And so that was my thesis. Until I start to go in, going in and look at the first few patients.
So you're reducing the scar, right?
Yes. So the thesis there, which is to basically, revise the scar, make it less visible, improve the quality of life, the less conscious of their disabilities, so to speak. Then the very first hour, and then up to about 3 hours the first morning, I start to realize that there's more to it. Because it wasn't the extra oral scar, it was the functions, which got to do with everything was bound down so hard for lip all the way to the alveolar. And that's where the thesis changed, took a big change, where we basically, did the work inside out.
So it's not just about aesthetic, right?
Yeah, it's got functions, you know.
Yeah.
Not just about aesthetic, we function because they all come back. And the biggest compliment I had that most of the kids got back is that I no longer think of my disability when I smile because that lip is not stuck to my jaw anymore. So that's so that to me is a big deal. And also that's meaning today when we're so conscious of lip tie, tongue tie, all of the nasal breathing and all the functional restriction because of muscular restrictions, having a free lip into muscle would be also potentially help the jaw growth better. And that again, when the jaw growth better, the facial aesthetic will improve as well. So I don't see the two things separated from each other, so they're part of it all.
Okay, so I learned about facial aesthetic when I took the fellowship from the Academy of Laser Dentistry in Dubai. We learn about buttocks, we learn about fillers, we learn about more about also photobiomodulation and everything. But for instance, like in Indonesia, my country, my beloved country, I cannot use those knowledge here because it's going to be illegal. And not just talking about facial aesthetic, even using a nitrous oxide in dentistry in our office is considered illegal because nitrous oxide should be performed by anesthesiologist, not by dentists. So for us Indonesian, probably some countries also have the same thing, the same issue. So how can dentists work with facial aesthetic in Australia?
Well, I think it's all come down to education with the interest, and the bigger the group of interest that you have from different, the bigger the crowd, the more voice you're going to have. And so I would say that we'll continue the same as regarding laser. In the beginning, there's a lot of push for facial aesthetic. Yes, we were told at first it was that no, it's illegal. You cannot touch Botox filler. It's full stop. And as the voice getting a little bit louder, then we will get yes, you can do maybe for TMJ. Treating.
I mean, do you have a curriculum about facial aesthetic in dentistry in Australia?
No, not the mainstream education.
Okay.
Up into, yes, there's a lot of politics, a lot of push, but up into 2015, where the big group of dentists has gone through and training with facial injectable in Australia. And at the time is, through, and it still is one of the group, the teaching is the Australasian Academy of Dento-Facial Aesthetics. And now we have more group over the medicals also teaching dentists doing this facial injectable too. But August 2015, then with pressure that we actually have the number that, have been going through the door of training. And so there's demand, and then we've got the formal word from Dental Board that we can do facial aesthetic as long as we train, and we've got insurance. The patient discussion. Yes, there's a whole list of things you have to discuss, and consents and all sort of thing. And then, recently revised. So there was still the ADA is still advised us to basically stick to the perioral treatment only rather than the whole facial. Pretty much it's not as strict as say no, the moment you say anything facial aesthetic, you will be in jail because it's legal. Not that bad. End of the day, I think you are responsible for what you're doing. You can substantiate your education, you cause no harm, you got good record taking, and then and you keep the patient safe. And so that's where I think if there's any country or anything that we need to change, you just need the number. So I think we'll start with continual little talk, little lectures, an hour here and there. The dentists will learn something from it and then create an interest, because all my interest in laser dentistry, only thing I do now, airway, sleep medicine, pain, it's all from the interest. You go for that group and you heard the doctor was been talking about cosmetic dentistry, you're just curious. So if we want change, you need to involve with the right group of, health professional.
I totally agree with that. But the problem is sometimes, for instance, if Indonesia is more like, you have blocks in dentistry. For instance, like many specialists kind of organization and something like that. And they start to block some treatments, some things, even with implants. Not mentioning about laser yet. I think facial aesthetic will be like, it's gonna be like crazy, crazy debates. I mean, not crazy in the good way or crazy in a bad way.
With any dentist, if you, because the moment you talk about facial aesthetic, any conversation we all had out in mind of this botched job, of these unpopular Hollywood face that make people think, why would I want to go there and be part of that crowd? But I would say pretty much anywhere I've been to and present to see where we're coming from in terms of part of the whole deal, everyone can see the point. I did a presentation in the middle of the whole group of medical doctors in Vietnam last year. And I was coming there talking about Star Walker's Q-switch laser with a dentist, accused with laser for skin pigmentation. Everyone, and I was the only one that didn't have any master graduation, a degree or anything. And I think I've created a bit of a roll of eyes, see what she's up to, what she's up to. But after a little while, I can see we make change, life-changing, by incorporating our dentistry, improving the look of the face. And we have our point, it's through education and through care, we can make people change of life. It doesn't mean that, well, I don't like that, therefore everyone not allowed to do that. But I think we should, open up. And until we have little things like that, when people say, I can see your point now. So I think at the end of that, the doctor kind of understand where we came from, why the dentist want to put their foot in. So we're not going to do everything the doctor will do. It's more so all about if they just stop, that we stop there. And I think that's part of the things we have to understand where you should involve, when you should involve, when we should stop. And that's, again, with education and training. And
so most of the facial aesthetic treatment that you do on daily basis, is it with laser or not?
The majority at the moment would be with laser. A lot of it around the perioral area. And then, a little bit all over the face. But it's pretty much, end of the day, we don't have a random patient coming in and just say, Doc, I want to fix my face. It's coming from our patient, even though we keep our presence on Facebook and Instagram and that. But it's all, I would say 98% of the time it's our patient coming off from dentistry, want to do something better now that their teeth have been better. And so I think that we keep on that track, we'll be doing quite all right.
Okay. By the way, I would like to welcome Dr. Rosana from Philippines, and also there's Doctor from Malaysia. Thank you very much for joining us with our special guest, Dr. Lin. And this webcast is live in Instagram at Imankusumadirja, and it's recorded, and you can watch it later if you missed the first part of the show. You can see it at my YouTube channel, Imankusumadirja. And by the way, if you have any question to ask my friend here about laser dentistry or about facial aesthetic, maybe you want to ask about Botox and fillers and everything, you can always ask by typing the question in the chat column. You can ask privately to me, or you can send it to a public, no problem. And I'm going to go back to the, I don't know, I love talking about controversy. So
Sure.
so 2015 was the first time that facial aesthetic grows in Australia. I mean, by dentists. Is it true?
No, 2009 there started to be courses going.
Okay.
And a friend who was trained at the time, who run this program at the time, and very much we everything was so we do under radar.
Yeah.
We say we do it and we don't cause trouble, so that on. And the number keep growing. Keep having training. They kind of keep training dentists. And so I joined, do my first course 2012, but 2015 when we legally can do facial aesthetic treatment.
So you don't have any like pressure from the other department?
Yeah, we do. In this country, I think in a lot of countries the same. Beauticians are freely doing Botox filler with no complaint. You can go and buy a class 4 medical laser to do skin rejuvenation with no problems. It's just that who want to sell it to that beautician is depends. And so those that, like for toner, they'd only sell to the doctor, for example, because they want people that got to be knowing what they're doing for. It's such a powerful laser, so they're not causing harm and talking about aesthetics. And so beautician in this country pretty much can do anything. However, should there be a complaint or something gone wrong, And those that are not registered, not regulated in any way, there is a code of ethics, there will be a code of practice that you'll be judged on. So whether it be Botox filler, whether it be laser, if you're not under any of this pressure of this organization or this board, then there's a general code that you'll be judged. And at the moment I'm doing my postgrad study in dermal science. And then there's different codes for different groups, like interesting dermal therapists here in Australia can use laser to do cosmetic skin rejuvenation without supervision of the doctor, as long as we don't claim it's a medical treatment, it's a cosmetic only. You don't remove suspicious skin lesion, you don't diagnose dermatological conditions, and it's quite okay to do that. Whereas cosmetic injectables, then it must be supervised by medical doctors, and dentists are on the list of the health board, that on the list of those that qualify to do injectables.
We're leaving the class. Hi, my name is Dr. Imankusumadirja. I'm from Indonesia. I want to